I'm Martin Knapp. I'm the Director of PSSRU at LSE. I've been in PSSRU for 39 years and 2 months, so a very long time, from the very beginning, almost the very beginning. Well, when I joined, there were 3 people, so it's changed quite a bit in that time because we're now probably 70, 80, 90 people, I don't know, across the 3 branches. So it's changed a lot in that way. So it's much bigger, we're much busier. I think we have a much bigger impact on policy and practice, and we're much more beautiful. 2 things I would say in terms of memories. One would be my very first day in PSSRU. The director at the time, Blevin Davis, was away on holiday, which was very unusual for him to take holiday. But he was worried that I might not have enough to do, so he left a big pile of books on the desk, about 2-foot high pile of books for me to read in the week or so before he came back. So that's a fond memory. But also I think PSSRU has been a really good family. We've had lots of lovely things happening, lots of people have started relationships, some have probably ended relationships, lots of babies, lots of marriages, 1 or 2 sad deaths, but generally it's been quite a community for a long time. I've done most things in PSSRU over that period, mainly looking at economic aspects of social care and mental health, and more recently looking at dementia and autism and those sorts of areas, nearly always through an economics lens. I could say surviving, having got this far. I think what I'm pleased about, I think, is the way that PSSRU has grown, but has continued to have a big impact. I think that's my proudest achievement, is helping the unit to achieve good things in terms of changing the world. In lots of ways there have been those impacts. One has been one of the very early projects that I didn't work on myself, but Blevin and David Chalice worked on, was the Kent Community Care Project, and then the various others that followed from that. And I think that was a very early indication of how PSSRU could have a really big impact on the case, on the practice level of social care. So I think since that date we've always been trying and striving to make sure that what we do is relevant in policy terms and has an impact in practice terms. And I think we have. I'm not going to single out other areas, but across many, many fields we've done that. I think the link between research and practice, it's developed a huge amount. I think there's much more of a 2-way flow of ideas and discussion and communication. Whereas I think when I first was working in the unit, and research at the time generally was like this, researchers would do things and publish them perhaps in obscure places and hope that other people would pick up the implications. Whereas now we're much more in tune with what the practice world needs to know, and we try and structure our research to help those practitioners. I'm not sure how to answer that, but I would say that there's a project we're doing at the moment, which we started earlier this year, on dementia, which is doing projections over a 25-year period and looking at how we can improve dementia care and practice. And when we won that grant and got the positive news from the funder, many of us thought that's exactly what we wanted to do. That was almost the ideal project for us. So I think I've been very lucky in my career in PSSRU to have done lots of pieces of research which have been almost ideal for me. So I've got no unfulfilled needs in that respect. I think there are 2 big issues. One is the obvious imbalance between needs and resources. So the needs for social care will continue to grow very rapidly. The resources to meet those needs are very tight. So that's one. The second challenge that worries me is whether social care will be subject to the same kind of political interference as we've seen sometimes in health systems in the NHS. Social care obviously gets controlled by local councils, but the influence of politics has been much less, I think, than in health, and that's been better for the social care system. Well, my answer to that is a difficult one because I'm much closer to that than anybody else in the unit, probably being the oldest person. I think for me, when my social care needs kick in, I feel comfortable that I've got a pension and enough house worth to pay for my own social care, but I do worry that there are millions of people who are not in that situation at all, and they'll be reliant on state support, and state support just won't be there in the way it has been there in recent years. So I am worried about that.